Good afternoon, everyone, or I guess if you're Pacific time or Mountain time, you might be just grabbing your lunch or getting ready for lunch. This is Leanne Bryan with the National Center on Subsidy Innovation and Accountability. Happy to see so many familiar names on our attendee list. Just making sure you all can also see who your peers are out there, and you should be able to see that. It is 2:01, and I think we're going to go ahead and get started today. Thanks for attending our webinar. Again, Katie, you can go to the next slide, please. This is Leanne Bryan with the Subsidy Center. Also presenting this afternoon is Katie Watts. She is our error rate lead here. From OCC Central Office, we have Shelley Dilks. Linda Winings normally joins us on these error rate cohort calls. However, she was not able to join this afternoon. Just one other quick note before we get started. I did also want to let everyone know that Janae Broadway is a new member of the Subsidy Center, and she is also part of our program integrity and error rate team. So if in the future you request technical assistance from the Subsidy Center, you may just get Janae. So just another name to keep in mind out there, but more information on that coming later. A few other housekeeping notes for today's call. First, we do have some downloads available over there in the handouts section of your GoToWebinar dashboard. So we have the data collection instructions. These are the new, just approved data collection instructions, as well as a second handout that just contains the mid-table, Missing and Insufficient Documentation. When Katie discusses the mid-table, you may want to have that handout printed so that you can follow along. The third handout is the slides for this afternoon. So today's webinar, like always, will be recorded. If you would like a copy of the recording, you can email Katie Watts. Her email is kwatts@wrma.com, but no worries if you didn't get it, jot it down. We'll display the contact emails at the end of the webinar. Throughout the webinar, if you should have any questions, you can use the Q&A box, or you can raise your hand. You can use the raise hand feature within the GoToWebinar dashboard. And again, throughout the webinar, we'll stop periodically for questions. And if you have your hand raised, we'll pause, get your question answered. I see that Jean Roberts from Wyoming, you currently have your hand raised, but I believe you've had it raised since you entered the room. There we go. Thank you. All right. Let's go ahead and get started. We're going to start out with a poll this afternoon to get everybody warmed up. As I'm looking through the list, we did have all 17 of our Year 3 states register, so I'm hoping that all are represented on the call. But again, just to kind of get us warmed up here, wondering if you've started conducting your reviews. Most of you have your record review worksheets approved, but we would like to know, and you can share with your peers here visually, if you've started conducting your reviews. So just a simple yes or no. If there are multiple attendees from one state, if you could just select one individual to respond so we don't have duplicate responses, that would be great. Looks right now about 40% have voted. I know we do have quite a few regional office staff on the phone, so we wouldn't expect them to be voting on this one. Up to 50%. Anyone else? While you all are voting, I do see a quick question here from Fiona in Puerto Rico, I believe. No, Fiona is in New Jersey. Fiona, my apologies. Where are the downloads located? The downloads are located in handouts on the GoToWebinar dashboard. There's a box or a link, handouts. If you make that box bigger by undocking it, you can see the 3 handouts, and you should be able to download each of those 3. All right, Kitty, do you want to go ahead and show us the responses? Perfect. So it's pretty equal. 47% have started conducting their case record reviews, and 53% have not. So interesting, about half. Thank you, good to know. And New Jersey folks, you have found downloads, great. All right, thank you for participating in that little poll. Now, for the purpose of today's call, we do hope to assist all of our Year 3 states with successfully conducting your error rate reviews. We're also going to describe changes and some additional data points that are required under the revised, those new data collection instructions. I apologize, there must be a little delay, and by the time I'm talking and you're seeing the bullets. The third item for discussion is to discuss the process for conducting the missing or insufficient documentation additional inquiry. So this is a new piece of the data collection instructions, and Katie's going to spend a lot of time talking through that this afternoon. So here is our Year 3 timeline. As I was looking at these slides just before the call, I was wondering, we've been doing this for 12 years now. Anyone other than me who's been around for 4 cycles of these error rate reviews? Quick show of hands. Was anyone around performing reviews in 2006? If you have, just do a quick hand raise. Wyoming. Oh, great. Montana. Oh, Beverly and Audrey, our regional office friends. Art Marcotte from the Subsidy Center. Great. Lisa from Michigan. Wow, so quite a few folks. Shelley, of course, from OCC Central Office. Great. So we'll be reaching out to all of you when there's questions that come up. Just kidding. All right, so the timeline. Your case review period is from October 1, 2017 through September 30th, 2018. The last day for the Year 3 states to submit their SDAP, Sampling Decisions, Assurances, and Fieldwork Prep Plan, was October 31st, and everyone did submit timely, so thank you very much for that. The last day to submit the record review worksheets is December 31st, 2018. And I believe last time I looked, there were only 3 states that have not yet submitted. So good job being ahead of the game on that one. And then finally, the 404 report, the improper payment report, must be submitted no later than September 30th, 2019. So if we start from the beginning, thinking about these data collection instructions, we're going to walk through some overview here. The DCI includes the instructions for completing each step of the CCDF error rate review process. And the DCI also contains the templates for each of those required submissions. The last version of the DCI, that one expired at the end of August, so August 2018. And the new DCI was just recently approved by OMB. And for those curious minds, OMB is the Office of Management and Budget. Again, you can download that new DCI from the handouts section of the dashboard, but it will be made 508 compliant here very soon, and then it will be distributed by the Office of Child Care via email. So those states that have not yet submitted their customized record review worksheet, you must use the template in the new instructions. There are also some changes to that 404 state improper payments report, and we will discuss that a little bit more in the webinar, but all of the Year 3 states will use the new ACF 404 report when you submit in June. So to reiterate, those states that have not yet submitted their record review worksheet must use the new template, and that can be found on pages 59 through 64 of the new data collection instructions. If you take a look at that new record review worksheet and you're familiar with the old one, you will notice a few changes on there. So the first one that we want to point out is in elements 100 through 400. There is a new item in column 4. This item is related to the missing and insufficient documentation errors, and Katie's going to walk through that in much more detail in just a few minutes. The title of section 4 has changed from income and payment to financial requirements and payment. And the title of element 410 has also changed. So please, please, please make sure that when you submit your template to the regional office for approval, if you happen to be working off of an old record review worksheet or one from your last cycle that you did a few years ago, you do need to make all of the required updates in your new record review worksheet. There are also some boilerplate changes to 5 of the elements. So element 100 is application redetermination forms, 320 parental work training status, 340 qualifying care, 400 income requirements, and 410 payment. So again, those boilerplate languages have changed in each of those elements. There's also a new element, element 500. This element is now going to contain the case summary. So before, you may remember that the case summary was included as part of element 410. It's now included in 500. When you all start conducting your case record reviews, there are a few things to be aware of under the new DCI. So that first big change is the requirement to examine the mid-errors, missing and insufficient documentation, look at those errors more closely, and collect some data on those mid-errors. This is required of all the states, even if you're working off the old DCI and you have an older record review worksheet template. The provider payment rate used to be included in element 400. It's now part of element 340. So this might affect how you as a state customize those elements and how your reviewers are going to examine those 2 elements of your worksheet. So as I mentioned in the last slide, reviewers will no longer include the case summary in element 410. The case summary will go into element 500. You can also refer to chapter 6 within the data collection instructions for a lot more information and guidance on all these changes and on conducting your case record reviews. So I'm looking to see if there's any questions. Dana from Hawaii has a question. 6/30/19, the day to submit the improper payments report is a Sunday. If the 30th falls on the weekend, the last day for submittal is the Monday following the 30th. But certainly, if you can submit before then, we welcome it. I don't see any other hands raised or questions. I'll pause for just a second. And then I'll turn it over to Katie to talk through the mid-table and additional inquiries.
Thank you, Leanne. I don't see any other questions, so I will go ahead with the section on the mid-table and additional inquiry. So if you are one of the states that has started their case record reviews, you might have sat in on a training with us a while back, or you might have had some one-on-one TA about the mid-table and additional inquiry. In that case, this might be some review, some refresher training for those states who have not started. I hope that you will understand the whole process for the mid-table and the data that we're collecting. And again, please feel free to raise hands or enter any questions. So when we talk about the additional inquiry for missing or insufficient documentation errors, we're referring to a process that would allow states to take a closer look at some of their mid-errors to determine whether the client ultimately met the eligibility criteria for child care subsidy. So for example, and we will go into an example in more detail in a couple minutes, the case file might be missing required documentation on income. However, the client maybe still did meet the income requirements. They were just missing that piece of documentation in the case file. So in the additional inquiry, the lead agency is allowed to utilize certain resources outside of the normal eligibility and review processes. And they might use these resources to make this determination of whether the client was eligible. So previously in our reviews and in our error rate trainings and the DCI, we emphasized that the reviewer would only be able to access what was available to the worker making the eligibility determination. So this is what we mean when we say normal eligibility and review processes. For the additional inquiry, the reviewer is allowed to step outside somewhat, and I'll get into that in a minute. Step outside of that to make this inquiry. And depending on the outcome, the improper payment error may be able to be mitigated for this review, which for your state might mean fewer improper payment errors and even a lower error rate. And of course, your state may still consider this to be an improper payment for your own purposes and may choose to take further action on that error. But again, this is just for the federal review. We might consider that error to be mitigated. And as Leanne mentioned a few slides back, this is a requirement of all states this cycle, whether they're using the old record review worksheet template or the new one. So again, for the additional inquiry, lead agencies may contact or utilize resources that are outside of the typical eligibility processes, but still within state agencies and systems. Specifics of this will vary from state to state. So when I go through examples here, just keep in mind that, you know, what is in my example might not be entirely applicable to your own state based on how you do things. The additional inquiry does not include things that the state already does to obtain missing documentation, such as checking shared screens with other programs or contacting local eligibility offices. It does not include independent or third-party review or third-party verification, not in the scope of this review. And please, 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 never contact clients, employers, or providers for verification. So basically, the additional inquiry must stay within state agencies. So I'm going to go through an example, and as you can see on the bottom left of your screen, if you're looking in the data collection instructions, please refer to pages 32 to 41 after the webinar to get some more information and examples. So let's say that we have a reviewer who finds they're doing a record review worksheet, doing a case review, and they find that the pay stubs are missing. So according to this state's policy, the missing pay stubs would make the case ineligible. There would be an error in 400, and without this information, the case would be considered a total overpayment. So let's think about a couple different scenarios for the case file with the missing pay stubs. The reviewer could reach out to the local eligibility office, which has always been allowed for the error rate reviews. So pretend that the reviewer called the local eligibility office and they located the missing pay stubs and forwarded them on to the reviewer. So this would not be considered an additional inquiry. And that's because the missing documentation was with that local office and contacting them is part of our normal processes. Okay, so if you're doing reviews and you run into this scenario and you get the pay stubs from the eligibility office, again, you would not need to complete the mid-table. It would not be considered additional inquiry. You might want to note in the comment section of your record review worksheet that you reached out to the eligibility office, but it would not be something that is captured on that mid-table. Okay, here's another scenario. Again, we have the case with the missing pay stubs. The reviewer reached out to the local eligibility office, but they did not have the missing documentation. However, the reviewer determined that the family received SNAP benefits and the lead agency shares screens with SNAP. The child care eligibility workers also have access to these SNAP screens. So this is a key point here, that this is something that the eligibility workers and the reviewers would have access to. So the reviewer, the reviewer goes into the system and verifies the family's income based on the SNAP information. So this would also not be considered additional inquiry. And why is that? Again, because it's something that is normal into the state's eligibility processes. The eligibility workers access it, the reviewers access it. It's part of the normal systems that the lead agency uses. So again, this is something where we might see differences from state to state. I see a hand raised. I'm just going to finish this slide with the third example, and then I will address the question. So bear with me for one moment. The third scenario here, again, we have the missing pay stubs. The reviewer reached out to the local office and they did not have that documentation. The reviewer determined that the family received SNAP benefits. But the difference from the previous slide is that in this state, the lead agency does not share screens, does not have shared systems with SNAP. The reviewer contacted the SNAP agency and the SNAP worker provided evidence of family income. So this would be considered additional inquiry. Again, the reviewer is kind of going outside what is normal processes for the lead agency to see if that missing documentation or the missing information can be found. All right, so I'm going to address a question that came in, and this is a really good question. Carol Adams, is the lead agency the same as the eligibility office? Okay, so again, in my last few slides, I've made reference to local eligibility office. And again, this is an area where we might see some minor differences from state to state, depending on how you do things. But when I'm referring to the local eligibility office, this would be a place that where clients can come in to apply for services, and they would probably have the case files, and then they would send the case files to the central lead agency for the purposes of the review. The local eligibility office may or may not actually be part of the lead agency. In some states, the local office is like, for example, a child care R&R, resource and referral agency, or another contracted agency. But it's the place in which eligibility is determined. I hope that answers your question. Leanne, did you have anything to add to that?
No, I think that was a good explanation. We can always unmute Carol if there's additional questions. Oh, I see. Thank you.
Okay, so I hope that makes sense. If not, feel free to raise your hand or ask for further clarification. Okay, so that is kind of what the additional inquiry entails and what conducting it might look like. So now I'm going to kind of go through step by step what the reviewers would need to do. So the first step, again, is to determine if the element has a mid-error that might result in an improper payment. So reviewers already in each element of the record review worksheet determine whether there's a mid-error. That's recorded in column 4. So what we would ask is that you determine if that error would result in an improper payment. And if so, in column 4 of the new record review worksheet, there's a new item, 2A, where you would code whether or not that mid-error might result in an improper payment. If the reviewer is working off of the old template, the old record review worksheet template, we ask that they record this potential improper payment error in column 3, because again, you would not have that additional 2A item in column 4. So the next step would be to conduct the additional inquiry, if applicable, if you can, and whether you complete it or not, you would need to go ahead and complete the mid-table. So the mid-table is part of the new record review worksheet template and is required of those states that are using the new template. For those states that are using the old record review worksheet, we really strongly encourage using the mid-table to record the results of the additional inquiries. It's really important to keep track of the data for the purposes of the final report, your final ACF 404 report. And then the last step would be to record the results. So in the new case summary element, which is element 500, there's some items in there about the additional inquiry and mid-errors. And I will show you that in a few minutes, an example of that. If you're working off of the old record review worksheet from the old DCI, you can include the results from your additional inquiries in your element 410 case summary in columns 3 and 4. So in the next slide, I'll show you some examples of how to complete the mid-table. And then in a few minutes, I will show you how to record the results, whether you're recording in 410 or 500. So this slide shows the mid-table. And you might wish to refer to your own copy as you follow along with the next few slides, since I'll go through column by column. So this might look kind of big, a lot of information in here, just looking at the table, but hopefully when I break it down, it will all become a little more simplified. So the first column in the mid-table just lists elements 100 through 400. Elements 410 and 500 are not included because there would not be an additional inquiry in those elements. So we'll continue with our example of the case file where there was a missing pay stub. Since that is an error for element 400, the reviewer who is completing the table would start at column 1 and jump down to the row with 400. So since this is the element with the potential improper payment error, that's the row that you would work from. In column 2 of the mid-table, the reviewer describes the documentation that was missing or insufficient. So for all of the columns requiring narrative responses, we don't want anyone to have to write a book. Stay brief but concise, as in the example here. So again, remember to make sure that you're in the row corresponding to the element with the error, which was 400 in our example. The reviewer here described that the pay stubs were missing, and they mentioned that it would make the case ineligible. So that's what the reviewer would write in column 2 of the table. In column 3 of the mid-table, include the dollar amount of the potential improper payment. So if it would be a total overpayment or if the case would be totally ineligible, the amount that you write down here would be equal to the sample month payment amount. Or if the amount attributable to the mid-error would only result in a partial improper payment, then you would record that result here. In our example, the potential error would result in a total overpayment, which we're going to say would be $250. In column 4, this is an item where the reviewer would code 0 or 1 based on whether there's an additional inquiry that could be made. So you might run into some scenarios where there's a potential improper payment error caused by missing or insufficient documentation, but there's no additional inquiry that could be made for various reasons. I'll give an example in the next slide. So in here, we're not asking if an additional inquiry would mitigate the improper payment, but just if the inquiry could be done at all. And again, I'll show you an example in the next slide. But if the state would not be utilizing an additional inquiry, you would code 0 and then continue on to column 5. If the state would be utilizing an additional inquiry, you would enter 1 here in column 4, skip column 5 and go on to column 6. Okay, so in the next slide, the next column, column 5, would be completed only if you code 0 and 4, so only if you are not going to be utilizing the additional inquiry. So for example, let's pretend that the client did not partake in any other assistance program, so there was no way of locating that income information. So that would be an example of what the reviewer would write here. And once you've completed this column 5, then no further columns need to be completed for the element. So again, column 5 only would be completed if you're not using the additional inquiry for that particular mid-error. So then let's go back to column 4 and pretend that we coded 1. Yes, we would be doing the additional inquiry. In that case, you would skip column 5 and move on to column 6. In column 6, describe what was done for the additional inquiry. So where did you go? Who did you reach out to? The reviewer in this example wrote a few sentences describing that they reached out to the SNAP office and that the worker was able to verify the income and provide the pay stubs. Again, just a couple sentences would suffice here. In column 7, code whether the improper payment was mitigated. So this is another item where you would code 0 or 1. Enter 0 if no dollar amount could be mitigated using the additional inquiry, and 1 if any dollar amount could be mitigated. So there could be a scenario where only partial payment was able to be mitigated. In that case, you would still code 1 here. And then in column 8, enter the dollar amount that was mitigated. So if the error was completely mitigated, as in this example, the amount entered here would be the same amount that was entered in column 3 for the error amount. So again, in our example, that would be $250. And then the final column in the mid-table is where the reviewer would describe how the information in the additional inquiry was used to determine whether an improper payment was made or whether the improper payment could be mitigated. So here you would not repeat what was done for the additional inquiry, but rather how that information was used. So as you can see in this example, the reviewer mentioned that based on the documentation provided by the SNAP worker, they could determine that the income that the client provided in the child care application was accurate. Okay. I do see we have a question that came in. I'm going to go on to the next slide and finish that, and then I will go ahead and address that question. I want to finish this thought. So this slide shows the mid-table again, but this time it has been filled in based on the information that we discussed in the previous slide. So the second to last row, as you can see, is the row that corresponds to element 400. And as you can see, the reviewer completed columns 2, 3, 4, skipped column 5, and then completed 6, 7, and 8. The bottom row of the mid-table asks the reviewer to total the figures in columns 3, 4, 7, and 8. So in our example, there were no other potential improper payment errors due to mid. So the amounts entered in this bottom row are the same as in the row for element 400. So this is just tallying it up. If you had a case where there were multiple mid errors that were potential improper payments and you had multiple rows filled in here, then you would be tallying them up in that bottom row. All right, so now for the question that came in. Let's see. And this is a question from Megan Reese in Nebraska. Would the missing information have had to have been available at one point during the review period? And I'm not 100% sure I'm reading this correctly, but so you're saying, would the missing information have had to have been available? I don't think so, and the reason why is that from the reviewer standpoint, you know, the reviewer would probably not have any way of knowing if the information was ever there during the review period. So from the reviewer standpoint, you know, the information is missing. Whether it was ever there is, I guess, would not be known. Nebraska is a multi-program state, so I will be able to contact all programs. Okay, that sounds good. If no program has it, are we able to use sources such as the work number? So again, this would be an area where it would differ from state to state, but I think that the work number, and I'm not super familiar with that, so please correct me if I'm wrong, but is the work number something that's kind of like within the state? I'm going to take you off of mute, Megan, if you don't mind, if you could just clarify that. One moment.
This is Leanne. I can jump in real quick. A lot of states use the work number to verify employment, income, and hours, kind of the information that you would normally find on a pay stub. It is something that has to be subscribed to. At least in my days in state government, we had to subscribe to it. Therefore, there's a fee involved, but many programs use the work number to verify employment and income information.
Okay. And I'm going to take Megan off mute in case you have anything to add to that, Megan.
No, that's exactly it. And we would have like one worker works all programs. Mm-hmm. So my child care worker is going to be working the SNAP case, the TANF case, our energy case.
Okay. And again, if this information that we're, thinking about is something that the eligibility worker and the reviewer, normally has access to, then it's not really considered part of this additional inquiry. But if the work number, going to the work number is outside of that scope, then yeah, I would say that would be part of the additional inquiry, accessing that.
So like if I was doing a review, let's say for November of 2017, and I find missing information am I able then to use work number like in November 18 to find it? If my staff would have been able to use it during that time?
So are you saying that you would be calling to verify if the client was working in 2018?
A work number is like an electronic verification, so technically my worker should have used it if there was missing information.
Mm-hmm.
And let's say they didn't for some unknown reason.
Right, right.
Or they didn't note it, or didn't do a screenshot, or print
Exactly.
off the page from the work number site.
That, yes.
So it's a verification system, Katie, that the workers have access to at the time of eligibility.
Okay. So I think that if they would have access to that at the time of eligibility, then that would not be part of this additional inquiry, if I'm understanding correctly.
So like if I had to do the additional inquiry to get the information though?
I'm actually going to ask Shelley to jump in here.
Sorry.
No, it's fine. It's a good question. And, you know, we try and think through all these things, but there's always, you know, and a lot of it is also just that, you know, the different processes in different states. So, Shelley, do you mind jumping in here?
There I am. Okay, I was going to say, take me off mute. Yeah, as far as I know, Megan, if this is something that's part of normal processes for, you know, the eligibility staff, that's something that's under the purview of the review. The review is looking at what the eligibility workers, you know, should have done, and, you know, or could have done. And so, according to policy and procedure, you know, if work number is one of those things, sure, that's part of what the reviewer can look up. But you're checking to see if the family was eligible back in 2017. And so, you know, checking the work number now is a bit of a challenge, because isn't that current information, or do you have an option of putting in your dates?
I can look at the option of every place that the client would have worked at with their social security number.
Okay. So yeah, no, that's fine. And Katie's right, that would not be an additional inquiry. An additional inquiry would be going to, you know, say you didn't do all of the programs all at once, you know, and you needed some income information, and the only place that had it that you could think of was going to be, you know, the MA office. I was like, you know, or something like that. And so you stepped out of your normal review routine, and called them to get this income information. That would be part of the additional inquiry. You know, you're able to do that with things that are sort of available within your state programs. You're not able to go outside of the state. You can't you can't contact employers. You can't contact landlords. You can't, you know, none of. There's still no third-party verification, which is similar to what a lot of QC folks do. So this is a little bit, you know, further down the road for additional looking, but not fully down the road in terms of third-party verification. So, does that help?
Yes.
Okay, cool.
Thank you.
Did that confuse the rest of you all on the phone? Or are you okay with that too? Raise your hands if everybody's good.
Raise your hand. Okay. I see a lot of hands raised, so I take it that means
okay,
that everyone's
excellent.
good.
Excellent.
At first, I misunderstood you, Shelley, and I thought you said to raise your hand if you're confused, and then all these hands raised. I was like, oh
no. No. I was hoping they were all good.
Yeah, no, I think it's good. But if not, you know, feel free to ask questions, or also when we do the evaluation at the end of the webinar, you know, write in there if you have a question, and we can chat offline. I do see another question that came in. So this is a question from Dana in Hawaii. So would that be an administrative error because the worker failed to document their process for determining eligibility, but it wouldn't be an improper payment error? So actually that's a great segue, Dana, because that's exactly what I mentioned in the next slide. So actually in these next few slides, I have some frequently asked questions that we've had about the additional inquiry, and this is one of them. You know, if I was able to mitigate a potential improper payment error using the additional inquiry, would there still be an error at all? So it wouldn't be a payment error if the improper payment was completely mitigated. There would no longer be an improper payment error, but it would still be considered an administrative error because, you know, there still was an error, you know, that documentation was missing. So in the relevant element, you would be coding as there being an error. And then for the case summary, whether that be in 410 or 500, you know, you'd want to make sure that you code the case as having an error as well. Okay, so this is a bit of a sticky situation that we might run into. What if the missing or insufficient documentation causes an error in multiple elements? We most often see this in 320 and 340, where there might be missing work verification that can cause an eligibility error in 320, which is work training status, as well as 340, which is where you determine need for care. So if you run into that scenario, we would ask that you complete an additional inquiry for both elements, complete the table, you know, the rows for each element. It's feasible that the additional inquiry might mitigate the error in one element, but not the other, or both, or none. But we wanted you to take a look at those separately. So you would be completing the corresponding rows for each element. However, since there are a few columns in that mid-table that ask for dollar amounts, we don't want you to enter the same dollars twice, because again, that last row in the mid-table is asking you to tally up the dollars. So we don't want you to tally up the same amounts and end up with an amount that's not accurate. So if the same dollars are in error in multiple elements, only record that amount in column 3 once. And if the same dollars are mitigated by additional inquiry, only record that amount in column 8 once. And this, again, might seem kind of abstract at this point because we're not actually on the table. But if you do run into this scenario and you have questions, again, feel free to reach out to your regional office and we can provide technical assistance on that. And this question has also come up where you contact an agency, say SNAP or Vital Records, and they will not provide the missing information. Maybe they have it, but they will not provide it. And in this case, we can't force them to share anything. So that would mean that the improper payment error would not be mitigated. And you would mention that in your mid-table, column 9, that you did contact the agency, but that they did not give them any information. Okay. Moving on, I know we only have a few minutes left. The final step for reviewers in the additional inquiry is to complete the case summary. And that would be in element 500 if you're using the new record review worksheet, or 410 if you're using the old one. So this slide shows an example of element 500. And unlike the other elements, we only have 2 columns here. One in which you would record a narrative version of the case summary, and one with the coding. So in column 1, the reviewer noted that we had a potential mid-improper payment error of $250. The additional inquiry was used and it mitigated the error. And there were no errors in any other elements. And since this is a case summary, if there were errors in other elements, whether they were administrative or payment errors, you would mention those here as well. In column 2, many of the items here are the same as they were in the previous iteration of the record review worksheet, but you can see we do have some new items. That's 2A through 2E, and these correspond to the figures recorded in the bottom of the mid-table. In this example, remember that the potential error was mitigated and there were no errors in any other element. So column 2 was still recorded as having a mid-error, as you can see in items 1 and 2. And as you can see in items 3 and 4, since that error was mitigated, it's considered to be a non-payment error. So that's if you're using the new template. If you're using the old record review worksheet template, complete element 410 as normal, but mention in your column 3 summary that the additional inquiry was utilized and mention whether the error was mitigated. In column 4, you do not have a place here for items 2A through 2E, which we showed in the previous slide in the new template. We do recommend that you keep track of these data points somewhere. So to be very clear, as long as you're completing the mid-table, you will have all the data you will need for the ACF 404 report, the final report. However, some of the instructions that we have in the DCI for the 404 report will ask you to refer to the items 2A through 2E. So for example, there's an item on the 404 where the instructions will ask you to tally up all of the items 2A, all of the item 2As from the record review worksheet. So having your own way of recording these 5 items for each worksheet might be helpful for when you complete the final report. You could have perhaps a spreadsheet to attach to each of the worksheets, or on your mid-tables, you could just jot down 2A, 2B, 2C, 2D, and 2E to record that data. And again, this is just so that you have something that you can easily refer to when it's time to tally things up for the 404 report. But it's not going to be included on your record review worksheet template. Okay, so I think now we had another question, or did we? Actually, we did not have another question. All right, so at this point, then I'm going to turn it over back to Leanne for the next few minutes to discuss a bit about the changes in the 404 report and next steps.
Thank you, Katie. I'll just pause for one quick second, make sure there's no other questions on that mid-table. Again, as Katie had said, you can always use the evaluation if there's additional questions. Maybe after you've had some time to review it, you can always reach out to the regional office for TA. So I'll go ahead and jump into the 404 report. As we did previously share way back in the beginning an hour ago, the ACF 404 does include a few new elements related to those mid-errors as well as the additional inquiry. And these can be computed from the completed mid-tables and element 500. There's also a new item on that 404 report that asks for the total amount of CCDF payments that were made for the review period, so over those 12 months. We asked for more information on pooled funds, including the number and percentage of the sampled cases that used pooled funds. So this might be something that you want to take a look at, think about a little bit now, and as you're conducting those case record reviews. And again, another reminder, if you need any TA related to those pooled funds and the calculation, feel free to reach out to the regional office and they'll connect you with TA. Also on the ACF 404 report, we're going to be asking you to share all of your error causes. So previously we had just asked for the 2 most common causes of error. We're also going to be asking for the action steps to reduce the occurrences of all the errors identified, not just the 2 most common errors. As we have in the past, we'll also ask for the amount of improper payments that was recovered from the previous cycle. What's new this time around is if that amount is less than what was expected to have been recovered, then you're going to need to describe the reason or reasons within the report. Finally, we'll ask for some more information about the error causes and action steps taken from the previous cycle, including those measurable impacts from the action steps identified. So the next steps for all of our Year 3 states, if you haven't done so already, you'll need to complete and submit the record review worksheet template that will be used to capture your case review findings. After receiving approval from the regional office on both your STAP and your record review worksheet, you're going to start those case record reviews, including the use of the mid-table. The third step is to schedule the joint case review with your regional office. So for the joint case review, we'll want to schedule that call after completing about 2 to 3 months of case reviews. So if you're a numbers person, that's like between 50 and 75 of your record review worksheets have been completed. We're going to ask to review about 10 cases with an improper payment and about 5 cases that show a non-payment error. If you've completed a few months of reviews and you still don't have any error cases, consider yourself lucky. But we do still want to schedule the joint case review. We do need to have that with each of our 17 states. It's very important for everyone to schedule that joint case review early in your review process. So during the joint case review, if we discover some adjustments that may need to be made, maybe it's something simple like the coding in column 4, or certain aspects of how the reviews are being conducted. We want to catch that as early as possible for you so that you don't have to go back and touch a significant number of cases. And we do, unfortunately, or maybe it's fortunately, identify, different elements in each of these joint case reviews where states do need to go back and touch minor things, and sometimes it's more significant. So again, just really important to get that joint case review in as early as we can for each of you. And the next slide is going to be wrapping it up. We one more pause for questions. I don't see any hands raised. But here on our last slide, we have our contact information, email addresses for both Katie and I. And we do very much appreciate everyone's time this afternoon. And we also appreciate those of you that can take 5 minutes and complete the evaluation. Certainly, again, that gives you an opportunity to ask any extra questions that may, have come about, and give us some feedback on how we might be able to improve these webinars for you all. So thank you very much for your attention this afternoon. I don't see any other questions or hands raised. So we will go ahead and sign off. Have a great rest of the day.
Thank you, everyone. Bye-bye.